Pharmacists, even before the COVID-19 pandemic, play a vital role in patient care, to name a few from dispensing of pharmaceutical products to counseling patients. However, the first quarter of the year 2020 has been one of the most challenging seasons for the different industries, most especially the healthcare industry, as the World Health Organization announced COVID-19 as a global pandemic. Good day, everyone. I am Arsenio Candia from the College of Pharmacy of Our Lady of Fatima University, Philippines. And I am here on behalf of my group to present our research entitled Perceived Barriers to the Implementation of Pharmaceutical Care Before and During COVID-19 Pandemic among Pharmacists in Selected DOH Hospitals in Metro Manila. Magkasi et al. 2020 did extensive research and showed that a new era in the pharmacy history has begun. During the COVID-19 pandemic, community and hospital pharmacists took on new duties and played a critical part in minimizing the pandemic's terrible results. To be more specific, this study aims to answer the following. Number one, the profile of the respondents. Next is to be able to list the perceived barriers to patient and medication counseling and dispensing before and during the pandemic. Next is to be able to prove that there is indeed a significant difference between the two variables, and lastly, to identify the most predominant barrier. Presented also are the individuals and groups that can greatly benefit from this study. Given these, it can be derived that this study can be used as a reference in future health crises so as to have a more resilient pharmaceutical system. Furthermore, the results and recommendations of this study will be proven significant should there be a pandemic ever again. This diagram shows the conceptual framework of the study. It depicts the dependent variable, which are the barriers to the implementation of pharmaceutical care, and the independent variable, which are the before and during COVID-19 pandemic. Of course, giving highlight to the specified roles of hospital pharmacists. The data was then gathered in a form of electronic survey and was subjected to the corresponding data analysis tools to exhibit, number one, the major predisposing barrier, and number two, the relationship between the barriers before and during the pandemic. For the methodology, this study followed a quantitative, cross-sectional, and non-experimental design and a non-probability purposive sampling method. For the respondents, this study has been narrowed down to the 14 participating Level 3 general and specialty DOH hospitals in Metro Manila, with an estimate of 20 pharmacists per hospital. Different consent forms were disseminated to the respected and listed authorities in order to attain and secure the participation of the respondents. After attaining their consent, an online survey questionnaire was administered through Google Forms. Finally, descriptive analysis was used to summarize the data and compare the listed barriers. These barriers were then ranked to identify the most predominant one. Meanwhile, t-test independent was used to prove the significant difference between the two variables. Moving on to the results of the study. First is the profile of the respondents. A total of 193 hospital pharmacists participated in this study. These pharmacists belong to the 10 out of 14 general and specialty DOH hospitals in Metro Manila. The following graphs show the distribution of respondents on different areas. The second and third problem of the study aims to know the barriers to the implementation of pharmaceutical care before and during the pandemic, respectively. In this case, the researchers enumerated 10 possible barriers for each role of hospital pharmacists that they can experience before and during the pandemic. The mean for each barrier was computed and ranked accordingly. Also, the composite mean for each role was identified, which led to the following values. In terms of patient and medication counseling, both internal and external variables were interpreted as disagreed to neutral. This can be explained by the study conducted by Gazeta et al. 2014, which stated that most of them are confident enough in taking care of their role, hence only minimal challenges are being experienced in implementing pharmaceutical care before the pandemic. The same trend can be seen in terms of dispensing roles, as most barriers were found to be disagreed by the respondents. This can be explained by the study conducted by Chung et al. 2020, which concluded that dispensing error rates are relatively low prior to the pandemic. In the previous slides, we found out that most barriers were not that relevant in the both roles of hospital pharmacists before the pandemic. However, during the pandemic, it was found out that most barriers were agreed by the respondents, and a relevant increase in the means can also be observed. This can be explained by the study conducted by Agaseta et al. 2014, which stated that most pharmacists need various trainings to develop their skills and knowledge to fulfill their role because of the experience in implementing pharmaceutical care during the pandemic. Following the same trend, it can be seen that most barriers were again agreed by the respondents, and this can be explained with the study conducted by Albedini et al. 2020, which stated that they managed to complete their responsibilities similarly to their co-workers without the same recognition as frontline workers during the pandemic. Moving on to the fourth problem of the study, this table shows the significant difference between the perceived barriers to the implementation of pharmaceutical care before and during the COVID-19 pandemic. There is an implication of the rejection of the null hypothesis given the lower p-value 2 tails compared to the 0.05 alpha value. Lastly, upon comparing the means of the listed barriers, we can derive that the external factors contribute mostly to the challenges that pharmacists experienced during the pandemic. All in all, this study concluded that during the worldwide health crisis, the role of hospital pharmacists is indeed significantly challenged. To be more specific, the following points were found after the conduct of this study. Prior to the COVID-19 pandemic, hospital pharmacists did not encounter many barriers in terms of patient counseling and dispensing. However, due to the numerous roles and responsibilities of pharmacists during the pandemic, they were not able to effectively counsel and dispense with regards to their medications. All in all, this study revealed that there is indeed a significant difference between the perceived barriers to the implementation of pharmaceutical care before and during the COVID-19 pandemic. As a result, the researchers recommend the following as means of moving forward: skills and competency training, inpatient counseling, enhanced pandemic preparedness planning, and ensuring that safety protocols are always practiced. Finally, the researchers would like to thank the listed individuals and groups for their significant and meaningful contribution that made this study a success. This concludes our presentation. Thank you very much.